Dr. Michael Bohrer from Reproductive Medicine Associates of New Jersey. My family was hard workers. My father was a businessman. He owned his own business. He would go to work early in the morning, work late at night, work many weekends himself to run his own business. And my mother was a teacher, so between the two, there was an emphasis on education. There was an emphasis on hard work. And they really basically said to me, be anything you want, but be the best that you can. When my kids were little, I used to bring them to the hockey games, and we used to go see the Devils play, and we'd take a train in to see the Rangers play. So hockey is still, interestingly, something in my kids' blood. Grew up in New York, so I went through school in New York. Went to a special high school, Stuyvesant High School, which really specialized math and science. So it really put me on the track for math and science. So I knew that I wanted to do something mathematical, something scientific in my career. And then I went to Brooklyn College. Brooklyn College had a BA-MD program, so I went 3 years to Brooklyn College, which then I was able to get accepted into Downstate Medical School a year early. And while I was in college, I did volunteer work at a hospital where I worked in respiratory therapy. After medical school, I did my residency at Johns Hopkins down in Baltimore. After that, I moved up to New Jersey, did my fellowship in reproductive medicine at Robert Wood Johnson Medical School, and then settled at the university. I worked at the university as an attending for the medical school for 16 years. And at that point, I found RMA, which was actually a relatively new place, but seemed to be really well on track. It was separated independent of the medical school control, and yet still very academic. Still very interested in doing research, still very interested in teaching. We still teach medical students, residents, fellows now, and I've been here for 11 years now. I think the most common question is really why do we have problems conceiving? Why is it us? And one can answer that in a number of ways. I like to really answer it primarily in terms of scientific information and try to give them some answers there. But couples are also answering it. When they're asking why are we having trouble conceiving, they're asking something much more personal. You know, why has this happened to us? And there really is no good answer to that. Infertility is random. It's not a punishment. It doesn't happen to bad people. Infertility happens to good people. People who are really going to make great parents. And that's why we're here, is to help those couples. I can tell you that it's not IVF of 20 years ago. Having been there at IVF 20 years ago, that things have come a long way. The medications that we use are much more patient-friendly. I know when patients used to do these injections of medications, the biggest part was not so much the injections. They really felt like they were being chemists, many of which hated chemistry when they were back, in high school, and now they feel like they're in that role again. And nowadays the medications are pre-mixed. They're much, much easier to utilize. The injections are not as big as they used to be, and our pregnancy rates are markedly higher. When I started doing IVF, we had pregnancy rates of 18%. And when we got up to 40%, we thought we were doing great. And now we're talking about delivery rates of 60% or higher on one try. I mean, the differences are so astronomically different. And the way we treat patients, I think, has gotten better because we've been critical of ourselves, looking at how can we make this much more patient-friendly. RMA is different in a lot of ways. One, we are really cutting edge. We are well ahead of the curve. And so because we are well ahead of the curve, because we are able to do things that maybe other programs aren't able to do, I think our pregnancy rates are higher. Another thing is we're very self-critical. We look at what we do very carefully. We're not afraid to say we're not doing a good job if we're not doing a good job to ourselves, and that we have to improve on the way we're doing things. And as a result, we've really pushed ourselves to be even better and better physicians. I personally feel that I'm a better physician since coming to RMA. I've had some funny experiences bumping into patients in very unusual places. I once met a patient on an airplane, and at one point in the middle of their conversation, I had to say something to my wife. I was 2 rows ahead, so I stood up and turned around, and the woman said to my wife, "Oh my God, that's my doctor." And they had just been discussing her infertility treatment for about a half an hour. My wife and I did a lot of cycles before we were eventually pregnant. Of course, things have gotten better over the years now. We might have gotten pregnant a little faster if we were going through treatment now, but we stuck with it. Hang in there. That's being persistent. It sometimes really pays off.